Thank you, ma'am. All right, welcome to the Training Tuesday today. I will be talking about several topics, including infant feeding cues, bottle feeding techniques, and food packages. Next slide, please. Whew. It's like lava in this room. So can someone read me the WIC mission, please?
I'll read it.
Thanks.
The mission of the Supplemental Nutrition Program for Women, Infants, and Children is to improve the health of low-income women, infants and children up to age 5 who are at nutritional risk by providing nutritious foods to supplement diets, information on healthy eating, and referrals to health care.
Awesome, thank you. Next slide. So our objectives are going to be to recognize infant feeding cues, understand proper bottle feeding techniques, and understand how to assign food packages to mom and baby dyads. So hopefully most, if not all of you, have this handy dandy little handout about baby feeding cues. If you don't, the web address is down there at the bottom, and I think Jennifer from Spalding made me this one. Laminated it for me, but this is something that I use when I counsel, and it's really helpful because usually when you have a parent and you ask on the blue form, what does your baby do, to show you that they're hungry, a lot of them are saying they cry. Well, we want to get to infants before they cry because really that's a late cue. Go ahead and change, please. Okay, so the infant hunger cues. Hand to mouth is one of the normal feeding cues. I know some parents say when they're teething, they always put their hands in their mouth, but you want to look for, a combination of these things. So turning to their caregiver when they're holding them in their arms, making sucking movements and sounds, sticking their tongue out, rooting, so that when the rooting reflex, when the cheek is stroked, they turn their head towards the parent or the caregiver. The flexed arms and legs or clenched fingers and fists, being fussy. Rapid eye movement is actually when they're still asleep, but they're kind of coming to, and that's always a good time to try and get them to the breast. If we're breastfeeding, to minimize their frustration, especially if you're having some issues with latching. And crying really is the last one. I should have put that last. Next slide, please. So it's important to feed the babies before the cues are observed, because if they're already crying, they're mad at you, they're starving, they want to eat now, and they're going to rush through their feeding. And rushing through a feeding is not a good thing, because then they may experience those colic-like symptoms. So like the upset stomach, the excessive gas, excessive spit up. They may possibly choke because they're drinking too fast. And they may possibly overeat because they're drinking too fast. And hopefully, well, not hopefully, but I'm sure that some of y'all have experienced this, if not on a daily basis, like I have, of, the complaints of these feelings. And when you ask, well, how long does it take for your baby to eat? They may say, oh, they're greedy. They suck that bottle down in 5 minutes. Okay, well, this may be the reason. Next slide, please. So on the opposite side of the spectrum, infant satiety cues, or satiety, people say it differently, are when they're full. And we really want to understand when they're full because we don't want to overfeed them and cause pain and all of the other things that come along with that. So they may push, if they're breastfeeding, they may push away from the breast. They may push the bottle away if they're bottle feeding. They'll extend and relax their hands and arms. They'll decrease sucking. They may draw their head away from the nipple or block their mouth with their hands. They may bite or spit out the nipple. They'll usually fall asleep very early in infancy. They'll usually just fall asleep. And it's important to pay attention to that more so when they're bottle feeding, because when they're breastfeeding, if they fall asleep, really they're going to let go of the nipple and it will stop flowing into their mouth for the most part. The bottle will continue to drip into their mouth. and they may fuss with their back arching. So I put a caution down here. They may not be able to spit the bottle nipple out depending on the feeding technique, and then the babies may continue to feed. And we want to avoid that because we don't want them to choke. So I've seen, this thing in my office where the baby is like flat and the mom has the bottle like this, and the baby is already, already asleep. There's milk coming out of their mouth, and the baby, wakes up in a frenzy because they're choking on the formula bottle. Or the breast milk bottle. So either way, when there's a bottle in the baby's mouth, you want to make sure that, the parent is paying attention to what they're doing. The baby's not flat. They're sitting upright when they're taking a feeding, or at least inclined. Next slide, please. So again, we want to pay attention to the satiety or the satiety cues because we want to avoid the same things. The colic-like symptoms, the upset stomach, excessive spit up, possible choking, and then overfeeding. So, does anybody have questions about these cues at all? If you don't want to ask right now, there's a case study later and you can voice your opinion. But I just wanted to know if these were clear. Hopefully they're clear. If not, please speak up because, there's plenty of people that can kind of clarify for you. All right, next slide, please. Okay, so the bottle feeding techniques to, help the baby to have a good feeding. We want to feed them when the cues indicate hunger. So again, the earlier hunger cues, the better, not the crying. You want to hold them in an upright position. So they don't have to be exactly, sitting up with their back flat, but you don't want them laying down either. So even a 45-degree angle is better than nothing. With a switch from one side to the other, and this is actually from recommendation from Kelly Mom, from an IBCLC, and so she recommended that midway through the feeding, if you're holding the baby here in bottle feeding, then switch to the other side and feed the bottle. So she was talking about having different views and then kind of becoming ambidextrous when you're holding the baby, so they're not having issues when you're feeding them. So a lot of moms will say, oh, he likes it better when I feed on the right side than the left side. Well, that's probably because you're right hand dominant. So sometimes it's better to go ahead and start switching to get comfortable with holding a baby in both arms. Hopefully that makes sense. Let's see, for 10 to 20 minutes at a time, ideally, you're going to feed for 10 to 20 minutes at a time because that's about how long it takes for your stomach to send your brain the signal that you're full. So if a baby is drinking a bottle in 5 minutes flat, are they full? Do they know that they're full? Probably not. Are they going to keep asking for food? Yes, probably. And then we're going to get into the, problem of overfeeding and all of the pain and gas and things that are associated with that. So we want the connection to be made. So we should be doing a slower feeding. And I know for a lot of parents, that's a difficult thing, especially when they have toddlers running around. I know, parents will express to me that they, are short on time, but really we have to emphasize that it's very important and it's going to alleviate a lot of the problems down the road if we can, have a feeding that's slow. You want to feed a baby gently. I see some parents, man, they are just shoving that bottle in the baby's mouth and take the bottle, take the bottle, take the bottle. They're like following the baby, trying to get the baby to finish a bottle and eat quickly, and I don't got time for this, let's do this. That's not how you should feed a baby. If someone did that to you, you would be traumatized. You wouldn't want to eat anymore. So it's really important that, you make sure to feed the baby with care. You wouldn't want someone to do that to you. You wouldn't want to do other things to the baby, like change the diaper in a fury. I mean, I know you do, but seriously, you want to take care of the baby. They are new to this world. So you have to, comfort them. If you're breastfeeding, you really want to have a consistent feeding with a breastfeeding rhythm. And the handout, the website for the handout, And I actually printed out the handout, and I know it's hard to hear. This is all the steps that are on the handout, and it goes into more detail. So if you're wanting to know more about like the details of this slide, all the details are on this handout. And I attached that to the email. And you want to feed them, obviously, to satiation. You want to feed them until they're full and no more. Does anyone have any questions about that slide? Okay. All right, Gwenna. Okay, so now we're going to switch gears a little bit. I was asked to talk about the food packages, so we're just going to talk about those briefly. So these are the options that are offered on WIC for mom and baby based on the breastfeeding status and frequency. They may be changed at any point during the certification period as needed, and I really implore you to tell parents that, because I find that when I don't say, hey, you can change this at any time, they're very uncomfortable, with making a choice with less formula. So I would encourage you to say, hey, you can pick it this month. If it's not working out, next month we can change this, because sometimes that makes the difference with them choosing an exclusive or a mostly breastfeeding package versus a some breastfeeding package. The options should be presented in a positive, non-biased manner in order to aid in decision-making process. So this is difficult. I see a lot of moms sit there and they struggle with it, and they're like, I don't know, I'm freaking out. What should I do? You really want to tell them, like, hey, these are your options. It's okay to pick one and change it later. Let me explain to you what all this entails. Let me go into detail, If you want to work out how many bottles you're doing per day and work out the amount of formula that you want to use, then we can do that too. Let's do the math, just to make them comfortable. Some people are numbers people. They want to know numbers. So, working it out with them may help. And you want to use your professional judgment or ask for help if you're not sure when you're making recommendations. Find someone who's done these food packages before if you're new, or find a CLC, IBCLC, whoever's in the building that can help with that. Next slide, please. So the exclusive breastfeeding package is offered to a mom and baby, or babies if she's had more than one baby, who are exclusively breastfeeding. She may not use enough formula to necessitate a mostly breastfeeding package, so a mom who maybe every once in a while will use some formula if they're going out or if somebody's watching the baby, but really she's not using enough to warrant maybe the one can that we're going to give her a month, or if she's using a different formula and maybe she's not using that much of it either. She says, I'm using Gerber Protect. Well, we don't cover Gerber Protect. We may not ever cover Gerber Protect. So, while it's a Gerber product, we can't offer it to her. So maybe she says, I only use it sometimes. It's fine. I can get it. Let me do the exclusive breastfeeding package. And as far as I know, that's okay. If not, hopefully Carol or Terry will correct me.
That's absolutely okay. Yeah.
Thank you, Carol.
Yes.
And then the food package examples would be E00 is the baby and W41 for the mom. We have so many exclusive, mostly some breastfeeding packages for moms, so it could be W42 if they're lactose intolerant. There's lots of different ones, but it starts with the W41 in your food package guide. Next slide, please.
Hey, Carly.
Yes, ma'am.
This is Lindsay. Can I say something?
Yes, please.
I know for myself, if there's any moms that are on the fence, like they're using the exclusive breastfeeding package, but when you talk to them, you really feel like there could be a switch pretty soon. It's a good idea to go ahead and explain to them the vouchers that they need to bring back if they're going to switch, or else they cannot receive any formula. I do not like to tell every mom that, because I feel like I don't want to scare them into thinking that, oh my gosh, I don't really want to get this package because I can't ever switch it. But if there's a mom that's like, I really want to breastfeed, but you know that she's, maybe struggling, she's getting help, but she may need a switch, to go ahead and let her know what she needs to bring back.
Yeah, thank you, Lindsay. I appreciate that. And that's something that's very, very important because I've had, I've had other people come up to me and say like, oh God, she can't switch and now she's upset. What do I do? What do I do? So yeah, that's really important to, feel out the mom and see if she's gonna, possibly come in pretty quickly or not. I mean, I think that's super important. So thank you for mentioning that. Okay.
Could you remind us which vouchers those are? I know that, I think Casey just told us this a little while ago, but could you tell me again?
I wish I could tell you again because I can't remember what Casey said.
Carly, I think, everybody double check this just to make sure, but I think they have to bring back the fish, the whole grain, and one other voucher. You can also go to the procedures manual, and it'll give you instructions in there on how to switch from a W41 to a W01 and a W01 to a W21. And it'll give you the scenario, like I know for the W01 to the W28, W08 to W28, it'll give you the scenario, like they brought back these vouchers, what do I give them? They brought back these vouchers, what do I, now what do I give them? So there are instructions in the procedures manual as well.
Yeah, that's what I usually do is I look up those pages and just to double check myself. And it's a little wonky with some of them because we have new food packages and it hasn't been updated yet. So you just have to kind of get some guidance, possibly call Casey or your manager if the codes aren't exactly the same because I had to do that one time for one of the food packages.
Carly, I just wanted to clarify that I think the policy and procedure manual at this time, they still don't clarify going from a W08 to a W28. It's a 21. And that's something that we've written to them and asked them to clarify and make sure that that's in the 2015 policy and procedure manual.
Okay, awesome. Yeah, that's probably the food package that I had one time, and I was trying to change it, and I was like, these aren't the same codes. I'm in trouble. So, yeah.
One more question, Gwenna, while you're still on there, and I don't want to stray too far off topic, but are we going to get that 2015 procedures manual soon? Do you know?
Yes, y'all will be trained on that as soon as we're trained on it. So it'll be around the 1st of February.
Okay, great, thanks.
February, okay.
Awesome. Okay. So the mostly breastfeeding package, obviously if they're mostly breastfeeding, and what that really means is they're using between 1 and 4 cans of formula, per month on average. And again, you may need to help them calculate that. I'm really about numbers when I'm looking at this package because some moms are like, I don't know, I use a different kind, every day, and I say, all right, well, let's average it out. Let's find some numbers. How many ounces per day? How many ounces per month? We can see it on black and white, and that way you'll feel a little bit more comfortable with your decision. So definitely, work that out with them, or ask the breastfeeding peer counselor or your CLC if you need help with a food package decision with the mom. And an example of that is a F17 for a baby and a W08 for a mom. So for the moms, it's like a WO something usually. And the mostly breastfeeding packages I think are FJK, and E. So those are the letters for the mostly breastfeeding package. Again, in your flip book. Next slide, please. So the some breastfeeding, maybe a mom who's breastfeeding one time a day or several times a day, but she's probably using more than 4 cans of formula on average. So that may be a chance for the some breastfeeding, and they may need help again with the calculations. Now, you can go either way on this. If a mom is breastfeeding several times a day and you think that she would be okay for the P17 or P27 or P37, whatever it is with the P, that's going to be that 6-can package. If you think she'll be good with a 6-can package, I encourage you to use that. If she's breastfeeding maybe once a day, you may need to go ahead and give her the A17, which is the 9-can package. and that would be a W28 for mom or the W20 something in that series. Any questions about that P17, A17? Because I know sometimes people have questions about that. No? Okay. Next slide, please. So, the non-breastfeeding package, obviously when a mom and baby are not breastfeeding, and that would be the A letter, 17, 27, 37, and a W28 is the same for mom. Next slide. Alright, so here's the case study, and I only did one because I wrapped up all the information into one case study. Because this is literally things that we see every day. A mom and baby come in to certify for WIC. The baby's 2 weeks old. Mom is breastfeeding about 3 or 4 times a day, but she's having some latching issues and some pain, which is probably why she's not breastfeeding more. And the baby takes a 4-ounce formula bottle 6 to 8 times a day. The baby spits up after each bottle of feeding, and she's offered formula, mom's offered formula since she came home from the hospital, but she tells you she would like to exclusively breastfeed, so she sounds like she wants some help with that. So just take a few minutes to discuss or think about it, and then we'll answer the questions. Is that your battery level, Gwenna? Henry, is Gwenna in the room? Does she know her battery needs to be plugged up? Thank you, Jessica. Alright, please don't let the PowerPoint die. We're almost finished. Alright, can someone from Region A or Region 1, you know who you are, Region 1, answer for me, how would you counsel this mom? And you can include in what questions you would ask, because that's part of the counseling.
Alright, this is David, Region 1.
Okay. Thanks, David.
First of all, I would start off by praising her, letting her know that she's made the right choice, to try breastfeeding and go over some of the benefits, to reassure her that she's making the right choice. And I would let her know, I would ask, what kind of pain is she feeling? How bad are the sensations, how often, how frequent, and if the baby is latching on, how often is the baby latching on, and also I would want to look at the actual latch. Or ask her questions about how wide the baby's mouth is being open, things like that, just to really look at the latch first of all, because she does want to breastfeed, which is good. So I would look more closely at the latch starting out. Those are questions I would ask her starting out after I praised her for wanting to breastfeed.
Awesome. And you being a CLC, of course you would ask the perfect questions about breastfeeding. So, someone who's not a CLC may need, the breastfeeding counselor or a CLC to come in and ask those questions if they don't have as much experience. So, for sure, those are awesome.
Yeah.
Anything else? Or are you good with that?
Sort of play it by ear. It's one of those things where you see where mom is, you see her comfort levels. But I really want her to leave the whole counseling session being confident and being reassured. Because I want her to have confidence in herself and her ability to feed her baby. So that's one thing I really focus on. And I follow up with I don't want to answer all the questions.
Yeah.
But
Yeah.
but just that first part, that's why I start off, just really looking at the latch and really but it starts with a desire. If she wants to breastfeed, then we can make it happen. And that's the attitude I have, and I try to reassure her that starting out.
Go breastfeed.
Crazy.
Awesome. Thank you, David. Anyone else want to add to any counseling or any questions that you would ask the mom or the parents?
Carly, I would like to know if she had talked to an IBCLC at the hospital, what she might have been told, if she talked to anybody at the hospital. You know, sometimes they'll talk to a nurse and be told one thing and just have the complete wrong idea stuck in their head to begin with.
Yes. Awesome. I agree. There's so many moms who they tell me, this is what they told me in the hospital. I'm like, ugh. I mean, I don't do that, but I really want to. I just want to throw my head against the wall, like, why? So, yeah, we need a lot of training for healthcare professionals out there. Okay. Anybody else would ask any different questions or counsel her on any other topics?
This is
Hey, Carly,
Erica Upson.
Hey, uh-oh.
Whoop. One at a time.
Oh,
Upson, I heard you first.
this is Erica and Upson.
Hey, Erica.
Being that I am a CLC and I absolutely love breastfeeding, I would definitely have a latch-in session with her. I would want her to show me exactly what positions she's using, because a lot of moms don't utilize every position, and it may be another position that she can use that she doesn't know about that may be a little bit more comfortable for her and the baby. That's happened to me a few times. Moms don't utilize the football hole as much, and that's like one of my favorites. And that's something I would definitely do. I would also look in the baby's mouth, because a lot of times babies are tongue-tied and moms have not been told that. So that would be another route that I would go.
Awesome.
Those are just a few things that I would do.
Awesome. Yeah, I have learned very much from Christy Tony, my breastfeeding counselor, that, yeah, more often than not, there's a lot of babies who have a tongue tie or a lip tie, and it's making it more difficult for the latch. And that's something that I started checking also, so that's important. Thank you. And then who else wanted to chime in?
Hey, I just wanted to follow up when David was saying that he wanted to make sure that the mom was comfortable, and we praised her. A lot of times I let my moms know that, you know, I'm always available. They can come back that afternoon. They can come back the days that I am in that clinic. I also make sure that they have our referral sheet at that time, and I go over it with them again to let them know that I am a CLC, that we do have a peer counselor, we have an IBCLC, and go over those referrals, because we can make them comfortable that day. But a lot of times the mom lose confidence after that visit, so I assure them that we're available at any time for them.
Awesome. Okay, thank you. Anybody else on those two questions? Okay. And I'm going to chime into that. The baby's drinking 4 ounces of formula, and they're 2 weeks old. And so that's when I start asking about feeding cues. When are you feeding the baby? When do you notice the baby's hungry? When do you know the baby's full? How do you know? What signs are they showing you? Because a lot of times they don't know. They don't know when the baby's hungry. They don't know when the baby's full. They just know the baby's angry, and they're trying to give it something to make it not angry. And that's, not the best way to go about feeding the child. So that's something that I also mention in addition to the breastfeeding, counseling, and the latching issues. And that's kind of the point of this PowerPoint, is to make sure that you understand what those cues are so you can explain it to parents, because I will tell you 9 times out of 10, they don't know what these cues are. They weren't told unless they went to a class or they've been reading, what to expect when you're expecting. I mean, they're not going to know these things. So, and they need to. That's one of the most important things. And you kind of touched on this a second ago, but what referrals would y'all make? Region 2. What referrals would y'all make for this mom, especially if you weren't a breastfeeding counselor? Anybody in Region 2 there? Is Spalding on? Did Spalding ever get on? No.
Hi, Carly.
Hey.
We would just be sure to refer the client to a certified lactation consultant. Oh,
Awesome. Or who else?
Carol.
or what?
Carol.
Or Carol.
Breastfeeding coordinator.
But that is a CLC also.
Yeah, but she is an IBCL.
Just say peer counselor. Oh, peer counselor.
I like that.
Just say this.
Uh-huh. Good job. Good job. Team effort. Team effort. Thank you, y'all. Okay, and then Region 3, not including me, what food package would you recommend for this mom?
Hey, Carly.
Hello, Miss Jessica.
Hi. I would try to get her to go mostly if we could. And like you said, talk to her about the feeding cues because I think 4 ounces of formula that many times a day is a bit much. So I would try to get her to go mostly, but if she's not comfortable with that, then some.
Okay. All right. Awesome. Yeah, I definitely think if we can try and counsel her through the breastfeeding and get her working on the latch and connect her with the breastfeeding peer counselor, the CLC, if you are not one of those, is going to be the most important thing. And if we can get her off to the right start that week, I think we'd be able to rock and roll on a mostly breastfeeding package and maybe eventually go to an exclusive breastfeeding package. That'd be awesome. But it's really going to be a team effort. You really need to get everybody involved, and you, as much as you can get the family involved, they need to be involved and supportive of the mom, and the breastfeeding counselors in the clinic, as well as yourself, and just encouraging the mom and letting her know that we are there to support her and her decision. That's really important. Anybody else have any comments on this case study?
Hi, Carly. It's Lindsay again.
Hey.
I just wanted to say something, just speaking strictly from experience with my own babies. Sometimes those cues can be very confusing. To try to have a little bit of, sympathy for mom when she comes in the office, but also, for those moms that are really like, I just don't know why the baby's crying all the time. Some babies just cry all the time. That happens from time to time. And just reassure mom that, going by the weight is really the only clear, if you've got this mom that's exclusively breastfeeding and they're just very confused, I don't know if they're still hungry, if they're not hungry, just reassure her and let her know you can come into the office anytime. We can weigh the baby. If you're, having some fears and some doubts, because sometimes all it takes is for them to see that weight and go, oh, wow, they are gaining enough weight. So, maybe my baby just cries a little more than the usual baby. So I always like to, give my patients the option to do that as well.
Awesome. Yeah. And that's a really great option because, I've totally told moms that, I'm like, we have several scales in this clinic. So if you need to bring your baby by, come on down. Like, it's no big deal, it won't take that long. And I know that some clinics are busier than others, but 9 times out of 10, the mom might not even take you up on that, but knowing that she has that available to her is going to help her.
And if she's got that fast pass, she can go straight in there and go straight up there and get the weight done. So that's another thing to let her know as well.
Yeah, absolutely.
Hey, Carly, this is
Yes,
Jessica
ma'am.
again. You brought up a good point a moment ago when you said something about the support in the family, because I think that's a really valid point. Because I know a lot of times that the moms end up offering formula because their family members are suggesting that they offer formula, or that every time the baby cries, someone thinks that means the baby's hungry. Because I know that happened to me when I was breastfeeding. More than one person were like, here, the baby needs you. And I was like, well, that's not the only reason they ever cry. So I think sometimes people's support has a big factor in how much formula they offer, if they offer formula, and paying attention to feeding cues, too. Because just because they are crying doesn't mean they're hungry either.
That's true. That's true. Thank you, Jessica. Yeah, I read a study last year that said if dad, like the dad of the baby, and grandma, maternal grandma for the most part, were not on board with breastfeeding, mom would not be successful with breastfeeding. It was a study that was done, and then if the healthcare provider, so like the OB or the pediatrician, were not supportive of breastfeeding or had no opinion on breastfeeding, the moms oftentimes were not successful with breastfeeding. So it is more of a struggle, I think, when you don't have that family support and the support of your healthcare providers. That's very, very important. So if the family members are there, please talk to them. I often address them when I'm asking the question as a prenatal. If dad's there or grandma's there and I say, how do you feel about breastfeeding to the mom? And they tell me, I look at the next person, how do you feel about breastfeeding? Because that's really important. And I need to know your opinion too. Because you can kind of tell straight away, is this going to be a possibility or is this going to be an uphill battle? Okay, next slide, Gwenna. So in summary, you should be able to recognize the infant feeding cues, understand proper bottle feeding techniques, understand how to assign the food packages to mom and baby dyads, and feel more comfortable with counseling clients on the above topics, hopefully. If you don't feel as comfortable as you would like, please ask someone questions about it, someone who has had a little bit more experience, or the breastfeeding counselors, or the CLCs, or Carol, or Terry. Ask about these things, ask your managers. It's really important for you to be able to counsel effectively for these parents. You might make the difference in their breastfeeding decision and their bottle feeding decisions. So please get, the experience and the training and the information that you need, because you're very important. Next slide, please. So in the spirit of good to great, this quote from Gandhi is one that I try and live by, and I have it on my business card and my email at home, and I really feel it's important to be the change you wish to see in the world. So if you want to see a healthier world, if you want to see a happier world, a world where people are active and eating right and doing the right thing, you need to be that example for everybody else. So I really encourage you to think about that in your day-to-day. And the other thing that I always think about is do unto others as you would have them do unto you. This is the golden rule. I learned this in kindergarten. I don't know why more people don't understand this simple rule. And I think maybe other people didn't learn it in kindergarten, but it's a very important rule. Don't treat others badly if you don't want to be treated badly, or treat others with respect if you want to be treated with respect. And that's anybody. That's your coworker, that's your customer, that's your elder, anyone. So just treat them the way you want to be treated, and for the most part, things will sort themselves out. And I think I have one more slide. Okay, that's it. Thank you for your participation. Do y'all have any questions?
I wanted to remind everybody to please fill out the evaluation. I'm going to send it out here in the next 10 minutes. So please, when you get a chance, check your email, fill the evaluation out. And the other thing that's very, very important is you sign the, make sure you sign the training list, that your name is on it, because this is very important when the state comes to audit us, that we have proof that everybody's been to these trainings. Thank you. Thanks, Carla. You did a great job.
Thank you. Appreciate it.
Geneva, are you still on?
I am.
Will you text me y'all's fax number at Meriwether, please?
I will.
Thank you.
Carly,
Yes, ma'am.
are you still